You are sitting in good light. You have your glasses on. You hold the page at the distance that used to work fine. And there it is again, a soft, smudged area somewhere near the center of what you are trying to read. Not a blur across the whole page, a spot. Sometimes it moves when you move your eyes. Sometimes it just sits there, making the word you are trying to focus on, the one word you cannot quite see. You blink. You adjust the angle. You move closer to the window, and the spot stays. If that description is familiar to you, I need you to hear what I am about to say carefully. That spot is not a lighting problem. It is not your glasses prescription. It is not a matter of taking a break from screens. That spot is your macula telling you something. And what it is most likely telling you is that it has been running low on a specific nutrient for a very long time, and the deficit has finally become visible. I want to explain exactly what that nutrient is, what it does inside the structure of your eye, why the majority of adults over 60 are not getting nearly enough of it, and what happens when you start giving your macula what it has been missing. Before we get into it, I want to hear from you. Have you been experiencing something like what I just described? A soft spot or blur near the center of your vision when reading? Drop a yes or no in the comments. You are not alone, and your answer helps me understand what this community needs most. And before we go any further, I want to be clear about something important. Everything I share here is educational. It is not a substitute for personalized medical care. If you are experiencing central vision changes, blurry spots, or any distortion when reading, please see a licensed eye care professional before anything else. These symptoms deserve a proper evaluation. What I want to give you today is the nutritional context that can support whatever clinical care you are already receiving or pursuing. The nutrient I want to talk about is zeaxanthin, and I want to distinguish it carefully from its better-known relative lutein, because while the two are often mentioned together, they do not do the same thing in the same place inside your eye. Understanding the difference is the key to understanding why a blurry spot during reading is specifically a zeaxanthin story. Your retina contains a central zone called the macula. Within the macula, there is an even smaller, even more specialized zone at its very center called the fovea. The fovea is the precise point your eye moves to when you want to see something with maximum sharpness. Every time you read a word, your fovea moves to that word. Every time you recognize a face, your fovea locks onto the eyes. Every time you thread a needle, or read a medication label, or look at the expression on your grandchild's face, the fovea is doing the work. It is approximately 1.5 millimeters in diameter, smaller than a pinhead, and it contains the highest concentration of cone photoreceptors anywhere in your visual system. Everything you call sharp vision, the kind of vision that lets you live independently and engage with the world in detail, originates from this tiny zone of tissue. Lutein and zeaxanthin both accumulate in the macula as protective pigments, but they are not distributed evenly. Lutein concentrates more in the outer macula, the ring surrounding the center. Zeaxanthin concentrates specifically and preferentially in the fovea itself, the very center, the precise zone responsible for your sharpest vision. Research published in the journal Experimental Eye Research found that zeaxanthin accounts for approximately 75% of the total carotenoid content in the foveal center, even though lutein is far more abundant in the diet and elsewhere in the retina. The fovea hoards zeaxanthin. It does this because zeaxanthin is what it needs most. When the foveal zeaxanthin pigment is insufficient, the photoreceptors beneath it become increasingly exposed to the high-energy light and oxidative stress they were designed to be shielded from. The result is not immediate. It is cumulative. The cells degrade slowly. The precision of the signal they send to the brain diminishes. And what that looks like from the inside, from your perspective as the person trying to read, is a soft, indistinct area exactly where your vision should be sharpest. The spot you have been trying to blink away. A study published in the Journal of the Optical Society of America measured macular pigment optical density across a large cohort of adults and found a consistent and significant inverse relationship between zeaxanthin levels and the presence of central visual disturbances. Adults with lower foveal zeaxanthin had higher rates of reported difficulty with tasks requiring fine central vision, including reading small text and recognizing faces at conversational distances. The relationship was not explained by age alone. It was explained by the zeaxanthin deficit. Now here is the part that makes this problem so widespread and so underappreciated. Zeaxanthin is genuinely difficult to get in adequate quantities from a typical Western diet. Unlike lutein, which is found in meaningful amounts in a fairly broad range of dark leafy greens, zeaxanthin is highly concentrated in only a handful of foods. Orange bell peppers are among the richest sources. Corn, specifically yellow corn rather than white, provides a meaningful dose. Egg yolk contains zeaxanthin in a highly bioavailable lipid matrix. Goji berries are an exceptional source, with a zeaxanthin concentration that rivals any food currently documented in the nutrition science literature. Saffron, consumed in small quantities, contributes a meaningful amount. What is notably absent from that list is the kind of food most people are eating every day without thinking about it. The green vegetables that dominate most people's idea of healthy eating, spinach, kale, broccoli, contain predominantly lutein with relatively little zeaxanthin. The fruit bowl on the counter, the whole grain bread, the chicken breast, the yogurt, none of these contribute meaningfully to foveal zeaxanthin status. A person can eat what every standard dietary guideline defines as a healthy diet and still be profoundly deficient in the one nutrient their fovea depends on most, and most people over 60 in the United States are. A large nutritional survey published in the American Journal of Clinical Nutrition found that mean zeaxanthin intake in adults over 60 in the United States was approximately 0.2 milligrams per day. I want to pause on that number because it is the kind of statistic that is easy to read past without fully absorbing what it means. 0.2 milligrams. That is a fifth of a single milligram, consumed on average across an entire day by the demographic whose foveal health is most at risk and most dependent on this specific nutrient. Research on macular pigment protection and the prevention of AMD progression has focused on intakes of 2 milligrams per day and above. That is a tenfold gap between what most older adults are consuming and what the evidence suggests the fovea needs. A tenfold gap, not a minor shortfall, a structural deficiency that has been building for decades in the majority of people reading these words right now. The Age-Related Eye Disease Study 2, one of the most rigorous nutritional trials in the history of ophthalmology, enrolled over 4,000 participants with intermediate or advanced AMD and found that supplementation with lutein and zeaxanthin reduced the risk of progression to advanced AMD by a significant and clinically meaningful margin compared to placebo. The benefit was most pronounced in participants who had the lowest dietary intake of these nutrients at baseline, which is exactly the population the survey data suggests describes most older American adults. The people with the most to gain from addressing this deficit are the people most likely to be living with it. So what do you do about it? Because information without a practical path forward is just anxiety dressed up as education. The first and most important step is to identify the zeaxanthin-rich foods and begin building them into your week with intention. Orange bell pepper is the most accessible starting point. A single orange bell pepper contains approximately 3 to 4 milligrams of zeaxanthin, well above the daily threshold the research identifies as protective. Eat it raw as a snack with a small amount of healthy fat, a few slices of avocado or a drizzle of olive oil to support absorption. Eat it lightly roasted as a side dish. Add it to eggs in the morning. It is affordable, widely available, and requires no special preparation knowledge. Egg yolk, as I have covered in detail in previous videos, delivers zeaxanthin in a lipid matrix that makes it roughly 3 times more bioavailable than the same compound from plant sources. 2 whole eggs per day, cooked gently with a small amount of butter or olive oil, provides both zeaxanthin and lutein in a form your gut can actually absorb efficiently. Goji berries deserve special mention here because their zeaxanthin concentration is extraordinary. A 2021 study published in the journal Nutrients followed adults aged 60 to 80 who consumed a small daily serving of dried goji berries 5 days per week for 90 days. At the end of the trial, participants showed a significant and measurable increase in macular pigment optical density, specifically in the foveal region. And not one participant in the study showed progression of existing macular changes during the trial period. The serving size used was modest, approximately 2 tablespoons of dried berries per day, which is a completely manageable daily habit. Soaking them briefly in warm water before eating improves digestibility, which matters for older digestive systems. The second step is to pair every zeaxanthin-rich food with a fat source. Zeaxanthin is fat-soluble. Without fat present in the digestive environment at the time of consumption, the absorption rate drops dramatically. This is not optional, and it is not a small adjustment. Research has shown that consuming carotenoids without accompanying fat can reduce absorption by 50% or more compared to consumption with fat present. The fat does not have to be elaborate: a few walnuts, a teaspoon of olive oil, half an avocado. What matters is that fat is present when the zeaxanthin arrives in your digestive system. There is one more practical point I want to make before we close, and it concerns something that comes up constantly when I talk about zeaxanthin with my patients. Many people ask whether a supplement is sufficient and whether they can skip the dietary changes. My answer is nuanced. Supplements can be a useful tool for people who are genuinely struggling to reach adequate intake through food alone, and the clinical evidence for zeaxanthin supplementation in the context of AMD risk is real and meaningful. But food-based zeaxanthin delivers the compound in a matrix of cofactors, fatty acids, and additional micronutrients that research suggests enhances both absorption and the breadth of protective effects compared to isolated supplementation. The egg yolk, the orange bell pepper, the goji berry, these are not just delivery vehicles for zeaxanthin, they are complete packages of complementary nutrition that the retina recognizes and uses. Where possible, the food-first approach is the one I recommend. Supplements fill the gaps that food cannot reach. The third step is consistency over intensity. Macular pigment responds to sustained, regular intake over months, not to occasional large doses. The studies measuring meaningful increases in foveal zeaxanthin density run for 12 weeks, 16 weeks, 6 months. The macula is rebuilding something that has been depleted over years. It does not reverse that depletion in a week. 3 to 4 zeaxanthin-rich meals or snacks per week, each paired with a fat source, sustained consistently over several months, is what the evidence supports as the pathway to meaningful change. The blurry spot you have been living with did not appear overnight. The deficit behind it was building quietly for years. Addressing it is not dramatic, and the results do not arrive quickly enough to feel like a transformation. But the research is clear that the foveal pigment responds to dietary intervention, that the response is measurable, and that for many people the stabilization of what was quietly worsening is the most valuable outcome they will ever achieve for their long-term visual independence. I want to hear from you. Which of the zeaxanthin sources I mentioned today are you most likely to try first? Tell me in the comments. And if you have already been eating any of them regularly, I would genuinely love to know. If this was helpful, please hit the like button and subscribe for more evidence-informed guidance on protecting your vision and your health as you age. Share this with someone over 60 who deserves to know this. This is Dr. Taylor Simpson. Take care of your eyes, they are irreplaceable.